So today's program is sponsored by Alexion and EMD Serono, and I would like everybody to give them a round of applause and say thank you. Fabulous. So today's program is about learning more about multiple sclerosis and similar but rare diseases. And to do about the rare diseases, we asked a few different patient advocates to come here and speak with us for 5 to 10 minutes each about what they are living with. We have one that has NMOSD, another one with generalized myasthenia gravis, and another person with multiple sclerosis. So our first person that's speaking, her name is Karen Hensel. And Karen is a 62-year-old wife, mother, and proud grandmother. For nearly 40 years, she's been blessed to share her life with her wonderful husband, and together they've raised two incredible daughters who have given us joy, joy. But in June of 2024, she was diagnosed with generalized myasthenia gravis, and she's met the challenge, and she's here today to talk to you about how she's battled this. So come on up, Karen, and let's talk about it, okay?
Thank you very much. Hi, my name is Karen. I've had a stroke and I have generalized myasthenia gravis, so I have to read because I can't remember what I was going to say. Sorry. Back in 2021, I received the COVID vaccine. Just 15 days later, I caught COVID. 15 days after that, I had a stroke. And then I underwent and replaced my carotid artery with a bovine vein. The doctors told me that my carotid had gone up and exploded. So that alone would have been enough for most people, but my journey didn't end there. On June 28th, I left a swimming party. And at the swimming party, it was really hot that day. And we got in the car to leave. And when we left, I looked at my cousin and I said, "I see two of you." And she's like, "You hadn't even had anything to drink. Why are you seeing two of me?" I said, "I have no idea, but I see two of you." So then by the time I got home, my face had dropped. My eye had closed. And so my daughter, who was an ER nurse, came to the house thinking that maybe I was having another stroke. And so she looked at me, checked my vitals, and said, "Nah, everything is fine. You just need to go to the eye doctor." So when I went to the eye doctor, he thought that I was having third nerve palsy. So they took all kinds of tests. He told me to go straight to the hospital, and they did all kinds of tests on me and said, wasn't having a stroke, wasn't having third nerve palsy. So I went to my first neurologist, and she ran tests on me, and she didn't really take my symptoms serious. She didn't think that, I was sitting there with my face drooping, but she didn't think that I had anything. She told me it was kind of in my head. So she referred me to another doctor, and by that time, I already had an appointment with Dr. Soubet, and thankfully, he believed me. So I was still sitting. I'd been sitting in the dark because I couldn't see. I couldn't. The pressure behind my eye was so bad that the light of the bedroom or the room would hurt. And I did this for 6 weeks of sitting in a dark room. And so by the time I saw Dr. Soubet, he ran tests on me and found out that I did have myasthenia gravis. Then he asked me if I wanted to do a research. And I said, "Well, would you do that with your mom? Is that what you want your mom to do?" And he said, "Yep." So I knew then that I needed to do the research. He told me it was going to be life-changing. Boy, was it ever. My symptoms had affected everything from my chewing, walking, blow-drying my hair. The things that you take for granted every day was overwhelming. And the road wasn't easy. And I spent 5 days in the hospital before I did the research. Spent 5 days in the hospital doing IVIG, and it would help for about 10 hours, and then after that, it would go right back. So we did this life-changing research, and I thought that I was getting, for the first 12 weeks, I was either going to get a placebo or I was going to get the real medication. Well, I thought I was getting the real medication. So I would go in, he'd do all these tests on me. I'd have to hold my hand out for 45 minutes. At 45-degree angle. And I could do it for a whole 15 seconds. And we thought that was pretty exciting because I was doing it for 15, whereas before I was doing it for 5. Then, after the 12 weeks of this research, I got on the real medication, and it was life-changing. I can now do 4 minutes and Dr. Subey's arm starts hurting before mine. It was definitely life-changing, and I appreciate Dr. Subey. And I said, is this life still hard? Yeah, it is. Am I still depressed? Yeah. But do I worry about my future? Yeah, I do. But now I know that with hope, that there is medication, that I can manage the ups and downs, and the ongoing research and support of my incredible doctor, I know that, and my faith, I know that things are going to get better. So, thank you.
Thank you so much. All right. Next, we have James Yates. And James Yates is a dedicated multiple sclerosis advocate, life strategist, and author of Mastering Life with Multiple Sclerosis. He was diagnosed with MS after enduring years of unexplained symptoms and a challenging path to diagnosis. Jim's transformed his journey into a mission of advocacy and education. Let's welcome James. Thank you.
Okay. Good morning, everyone. Like Stuart said, I am Jim, and I want to share with you all a piece of my journey to get to where I'm at, mastering life with MS. So some of you may have heard me share my journey before, and you know it can be quite animated and very detailed, but for the sake of time, I'm going to give you the crash course, or I should say the speed round. So my very first symptom I experienced was a migraine. 1 week after our third child was born, she got RSV. I started having migraines. I worked in leadership for a nonprofit. It was Q4. We had in-laws in town because it was a holiday. So I just attributed the migraines, the daily migraines, to all that stress. But by day 30, I got concerned. So my wife and I decided to go to the ER. They did a CT scan. No findings. The hospitalist said, hey, it's a person living with chronic migraines now. So follow with a neurologist. So I did just that. I went ahead and looked for neurologists here in DFW and could not get in because they either were out for the holidays or they weren't accepting new patient referrals to mid-April. But I lucked out. I was able to find neurologists in North Carolina who would see me via telehealth. And we did the ins and outs. He did what he's supposed to do on his end, process of elimination. And this went on and on and on until I told him one day, one visit, hey, I feel like I'm going blind. I can't see. And that triggered him to schedule an MRI or send an MRI referral over to my choice of imaging center. So I went through that process. That was my very first MRI, everything. I conquered it. I'm so excited to get my results because he's going to be able to tell me, fix this, get rid of the migraines. And to this day, I remember the phone call and hearing him say, I was not expecting this, Jim. This is not what I was expecting at all. This is looking like brain cancer. I have to get you back to the imaging center to do more scans, and I need to do a stat. So, of course, during that waiting period, because of insurance, I had to wait for prior auth, I started to spiral. And I started to get in on the internet and research. And I found myself getting to a point where I was doing end-of-life planning because I said to myself, my wife and who's the mother of my 3 children cannot have this burden. I did my research and I knew that the most aggressive form of brain cancer would have a 5% or less survival rate. So I started quoting burial plots. He got the results back and he said, I still don't know what this is. I need you to go see a neurologist, put hands on you to confirm what this is. It could be, I'm certain it's brain cancer, but it could be an autoimmune disease. It could be an infection, but you have to see a neurologist. He tried to get me a direct admit to 3 different hospitals here and had no luck because he's not local. So the only way I could see a neurologist and get a neurology bed in a hospital was for me to go directly through the ER. And I was able to do that successfully. Now, I won't share with you all how I did that for the reason, but I was able to get me a bed. So fast forward, I'm in a hospital, days go by. Finally, the neurology team comes in and I finally get the news I want. What is this? That was the answer. What's the answer to that question? And they, congratulations. Well, not congratulations, no, but they didn't say that. But Mr. Yates, we can confirm that it's not brain cancer. So my wife and I, we celebrated. Yes, it's not brain cancer. but it is multiple sclerosis. Yes, it's multiple sclerosis. And then the very next thing I asked them was, okay, what is multiple sclerosis and what pill do I have to take to fix it? Because I had no clue what it was. So upon my discharge, that's when my journey to mastering life with MS begun. And I pushed pause on life. I left the workforce. I quit my job. I wasn't really involved with family life. I was fixated on, I just need to fix this. I just need to make MS go away. And that consumed me. And then until I had the second relapse. And then I said, okay, well, Jim, you're going about this the wrong way. You can't fix it. You can't make it go away, but maybe you can prevent the next relapse if you do A, B, C, X, Y, and Z. So I researched and tried this, tried that, until I had the third relapse. I had 3 relapses in a matter of 15 months. So then it took me having to really reprogram my mindset and accept that I have MS, but MS does not have me. And I can't fix it. I can't make it go away. I can't even prevent a relapse per se, but I can do everything in my own power to be responsible and minimize any damage that may come along if another relapse happens. So once I accepted that, I pressed unpause and I was able to become present and be involved just in life with friends and with family. I was able to be productive. I got very, 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 very involved with the MS community. Any community event out there, I was there. Any free resource that was tailored or targeted for the MS community, I took advantage of it. I participated I'm in a clinical research trial right now. I also participate in support groups and what have you. And then lastly, what I had to conquer, and this was the hardest thing, and this is me speaking to my MS peers who are newly diagnosed. I'm talking a year and under. The hardest thing to conquer was building psychological immunity. And what that is it's many things, but one thing I had to start with was speaking positive, I should say. So what that means is that how I talk to myself about my MS and how I speak about my MS to others needed to be positive. So real quickly, one thing I share with, like I said, newly diagnosed MS patients is if you go to bed with some symptoms and you wake up at 3 a.m. and you have those same symptoms and you get up at 3 a.m. you say, oh, I have the same symptoms that I had last night and this is horrible, MS sucks, and how am I going to make it through the workday? They're going to fire me, this and that, and this is going to be such a horrible day. It's going to be a horrible day because you're believing that. But if you wake up, and this is a daily practice of mine throughout every area in my life, you wake up and you have those symptoms, you say, you know what? In this moment, I'm having the same symptoms I had when I went to bed, but by lunchtime, it could be different. What that does is you're taking control back. You're not allowing it to consume your mind throughout the day. You're not allowing it to decide what the outcome is going to be for your day in this moment, but it could be different. And I say different because we don't know if it's going to be better or worse, moving forward. But if we don't allow that to be our focus, it allows us to be able to be present. So in the moment, I'm present. So I'll share something very intimate with you all. I've been having temporary vision loss. That symptom has come back on and off for a couple weeks. Right now, everyone is blurry. So in this moment, I was a little blurry. Hopefully by, the time I leave here, it could be different. If it's not, I will address that then versus, oh, well, I'm going to get through this event or what have you. So to recap, talking to my peers in the MS community who are newly diagnosed, remain present. Do not check out. Do not surrender. Become productive. Get involved with events like this that Mr. Stewart is hosting and all the other events we have for our community. Get involved. Take advantage of those free resources for MS patients. Get involved with a clinical research trial. I am, and it's amazing. And lastly, work on being positive, and that is the hardest thing to do, and it will take the most time. But work on being positive to build your psychological immunity. Thank you guys for your time.
That was great. Thank you, James. All right, next we have Evie Marcus. She was born in Mexico City and moved to El Paso, Texas as a young child. She was the youngest of 3 girls and always strived to be like her older sisters. She's a doting mother to a 15-year-old and 2 fur babies, Pearl and Puff. Today, Evie will tell us her battle with NMOSD. Come on up, Evie.
Hello, everyone. So I'm actually here on behalf of Dr. Subay, as he mentioned. My journey started in July of 2023. And similar to Jim, I started off with a headache. I also was going through kind of a crazy time in my life, a lot of things going on both personally and at work. And so I attributed the headache to that. I took some ibuprofen, hung out, watched TV all day, and went to bed. When I woke up the next day, I realized I started to see a spot in the corner of my right eye and thought nothing of it, just continued on. It was a Monday, so I went to work. Continued life as usual. By Tuesday, I realized that half of my vision was gone. So I called my eye doctor. I had started using glasses about a year prior, and he gave me an appointment for Wednesday. Wednesday, I came in and they let me know that I needed to come in the following day to see a specialist because I did have some swelling of the optic nerve. Thursday, I come in, and when I see the specialist, he tells me that I need to go to the ER. So I proceed to go to the ER. They immediately started me on the IV steroids for 5 days, as is the regular treatment, and I was actually seen in the hospital by Dr. Subay. We've been very blessed that within a week, he gave me my diagnosis of NMO. And this was beginning of August of 2023. I had my first infusion in November, and it's been great so far. Luckily, I have no relapses. I never fully regained the vision in my right eye, but I can still use my peripherals. And so it's definitely been a struggle. I've also had to overcome other things that I don't know if specifically were related to it, but had a lot of fainting spells, which Dr. Subay was able to direct me to the correct people so that I could get that treated. Most recently, after my last infusion, I also started having some digestive issues. So it's looking like I may have Crohn's disease, which this week we will be confirming with my gastro. But just really wanted to say thank you to Dr. Subay. I know a lot of patients that have a lot of trouble finding their diagnosis, and just really blessed that he was able to get us in the right direction right away, that the damage is not something that prevents me from living my life normally on a day-to-day basis. I'll say the side effect that I struggle the most with is fatigue. And so, as Jim said, it is hard to be positive and to try to continue every day when you don't feel your best. And so this is my first event meeting other people with my similar condition. I've kind of been a little bit of a recluse, so really enjoy hearing your guys' story and seeing that there is a light at the end of the tunnel. And yeah, that's a bit about it. Thank you so much.
Thank you. That was great. Have a great day, everybody.